everyone, and happy Tuesday. Welcome to today's segment of Green Chat. I am Stephanie Gluchacki of Canacare Docs, and I'm very lucky to be joined today by Erica Pukic, who is the area manager for our Mid-Atlantic clinical offices. Erica, say hello to the Facebook community here.
Hello, everyone, again.
So again, we're really excited to come to you today. There's lots to talk about. You can see we're joining you from the New Jersey Facebook page. Our New Jersey centers are just anxiously awaiting to certify patients. Even amidst the COVID environment right now, patients are still able to be certified via telemedicine. So that same great service that patients have come to know and appreciate in person are still available via telemedicine. Again, we're still in the midst of that ever-changing COVID landscape, but the one thing that should not change is your ability to access medicine, which of course starts with a certification with a licensed clinician. So Erica and I are going to talk a little bit about that today, some of the changes to the New Jersey program which benefit you as patients, or if you're not a patient and you're kind of wondering what are the benefits or why should I become a patient, we can talk about those for you today. So today's agenda items, we're going to talk about an unfortunate loss in the cannabis community. Lester Grinspoon, sad loss last week. Acclaimed cannabis advocate Dr. Lester Grinspoon passed away last week at the age of 92. Dr. Grinspoon was a psychiatrist, a retired professor at Harvard Medical School, a published author in the field of drugs, drug policy, and he authored more than 140 articles in scientific journals and even wrote 12 books, including Marijuana Reconsidered and Marijuana, the Forbidden Medicine. So definitely thank you, Dr. Grinspoon, for all of your contributions to the industry. From a scientific perspective, you know, your validation of cannabis as medicine was very inspiring and really sparked a lot of initiatives for others looking at cannabis as medicine. So our thoughts certainly go out to the Grinspoon family. You will be missed, but your legacy will remain. I am now going to turn it over to Erica. Erica is by far the expert in the New Jersey medical cannabis industry with Canacare Docs, and I'd like her to be able to share a little bit about, first of all, the history of how Canacare Docs came to be in New Jersey, some of the trials and tribulations that we went through last year, and then basically how we got to our journey and basically how we can serve you as a patient today. So Erica, by all means, take it away.
Okay. All right. So, I mean, New Jersey's program, the law was written quite a while ago. So, I mean, it was very antiquated as we entered New Jersey 1 year ago today. So at the time of entry, we were still required to write a maximum of 90-day certifications. The cost in New Jersey for patients was exorbitant. A lot of practitioners were charging upwards of $400 within the first month and an additional $100 to $200 every 90 days. Record requirements still existed. It was just kind of it was probably the highest priced program I have had the privilege of overseeing, and it wasn't very competitive. There was only 6 dispensaries at the time. So I think that in a year, New Jersey, not only the regulators but the advocates pushing for these changes have done such an amazing job of basically modernizing the New Jersey program. So with that, there have been the addition of more permits for dispensaries. So in the last year, we have seen Zen Leaf open. We have seen Columbia Care just open 2 weeks ago in Vineland. The Apothecarium in Phillipsburg is going to be opening, hopefully sometime in August. I know it got pushed back just a little bit, as they typically do. But nonetheless, we have seen tremendous improvement in New Jersey since entering the market market. And one of the things that has certainly fit our model a little bit better is allowing us to lower our costs and certify patients for a maximum of 12 months at a time. However, there are still, confusion with patients as far as, the 2-year license that's issued by the state versus your 1-year certification. So we're just doing our best to make sure patients are understanding the program, educating them on the use of cannabis, and just doing our part in the market to make it as simple as possible, because that's what we're known for. We walk the patients through the entire process, which can be kind of confusing for patients who are not very tech savvy. I know sometimes I have to look at the instructions for like renewal patients and how to re-register them with the state and get their new card. But nonetheless, we are doing, I think our team is doing a fantastic job of just, bringing our expertise, our systematic approach to assisting patients to New Jersey, and just, like I said, eliminating as much confusion as possible. And I know sometimes we get a little inundated with communications and our schedules are full. But again, once you get in, we are there for you on a continuous basis, and we're expanding our team and we are expanding our reach. And with the ability to do telemed, we really are able to serve the entire state of New Jersey, and in a, like I said, a streamlined, systematic way, so that nobody's dropped through the cracks, and we're just really taking care of each patient and tailoring that care to their experience. So we have a lot of patrons as far as the medical marijuana program. They've been in it since 2011. They've seen the progress. They're mostly grateful for the progress. Of course, everything, there's always room for improvement, but nonetheless, we've been cleaning up a lot of our processes to adjust to New Jersey, and like I said, adding staff that are super helpful, and just genuinely doing our best to help patients in New Jersey.
You brought up some really key points there, Erica. And again, as Erica mentioned, CannaCare Docs organization acquired a patient base in New Jersey about a year ago. Today is the anniversary of that. And there was a plethora of patients who came to our organization, and unfortunately many of those patients were being renewed at a time when the actual laws themselves were changing. So not only did they experience a change of the organization that was managing their care, but also the changes within the actual regulations and the industry itself. So that compounded a lot of the confusion, the frustration that occurred. And I believe, to Erica's point, we've done a great job in managing and truly understanding our patient needs, and going so far as to, as Erica said, expanding our staff, expanding our hours, expanding the ability to really understand what a patient's needs are, whether it be certification or education or even questions and answers. So really taking this year to focus on the needs of patients of New Jersey or potential patients of New Jersey. We certainly want to invite you to look into CannaCare Docs as your trusted source for cannabis certifications. How do you do that? Visit our website, www.cannacaredocs.com. Click on Book an Appointment Online, and it's as easy as selecting a day and time that works best for you. Again, amidst the COVID environment, there's no need to leave your home for this certification. You can do this compliantly through the privacy and security and safety of your own home. So prior to your appointment, one of our administrative team will reach out to you to manage a lot of the preparation work that's necessary, the gathering of medical documents, the gathering of your identification. So all of that will be managed ahead of time prior to your appointment, so that on the day of your appointment, the true focus is on your conversation with your practitioner, your doctor, to ensure that your needs as a cannabis patient are met, that you have true understanding of cannabis as medicine. So again, we really invite you to visit our website, cannacaredocs.com. For those of you who have friends, and those of you in our northern New Jersey communities, if you have friends in the New York area, share with them. We can certify New York patients via telemedicine as well. Same process. They can go to www.cannacaredocs.com, select Book an Appointment Online, and then go through the same process. So we're really proud of that. Excuse me. So a couple of exciting things happening in the state of New Jersey. Erica alluded to a few that have taken place over the last year, but more recently, medical cannabis just got cheaper. It did. So the New Jersey sales tax on medical marijuana will be cut to 4% as of tomorrow, which is down from 6.625%. And that's the first step in a 3-year plan to reduce, to phase out state taxes on medical cannabis purchases. So starting tomorrow, a year from tomorrow, that sales tax will be reduced even more, down to 2%, hopefully by 2022, erased completely. Because one of the common frustrations that we hear from medical cannabis patients are that they don't pay taxes on traditional pharmaceuticals. Why are they taxed on their medical cannabis? And certainly our viewpoint is cannabis is a medicine. It is a form of therapy to help patients achieve their healthcare goals.
Another development is the addition of home delivery that's now been approved. Yep. So dispensaries, all they do is fill out a form and submit it to the state. The Department of Health will then approve their process because each dispensary will have a different process. And we've already, as CannaCare Docs, we have already started to reach out to the dispensaries to figure out where each dispensary lies on their implementation of this. So we spoke to Columbia Care. They were meeting last week to discuss their plan of action and to begin the submission of their application. I know that Curaleaf is working on it as well. Zenleaf is working on it as well. So we are continuing to, communicate with the dispensaries so that we can give you that knowledge first, which also brings me to the point, if you're a patient, you will be receiving monthly newsletters that will have the addition of, all of these changes that are coming or happening. And you'll get that in the newsletter on a monthly basis. And also, as the states begin to reopen, be sure that you're following us on Facebook so that you can catch any of our representatives out at disclosed locations. I know that right now I'm planning one for, it's right over the New Jersey line in Stroudsburg. We're going to be planning to do an education and virtual assistance or virtual certification event for New Jersey and Pennsylvania patients. I'll be there to support the patient, but the doctor will be able to complete certifications as well. So if you need assistance, if you're not good with uploading documents, or you just really want to ask someone in person, follow us on Facebook, check out the events. That'll be coming out soon. And that'll be at the 420 CBD Lounge that just opened right over the New Jersey line. And again, they're going to allow us to use their venue to reach patients that are just a little intimidated by the whole telemed process.
That's great news, Erica. And intimidation aside, not everyone has access to the technology necessary either. So not everyone has a printer, or maybe you have a printer at home, but because you're at work most of the time prior to COVID, you didn't recognize that your printer was out of ink or didn't connect to your Wi-Fi. Whatever number of reasons you're having challenges accessing telemedicine, these opportunities are there for you. And we recognize that everyone has different situations and different hurdles to overcome to access their telemedicine, and we're here to help you through that. Let's talk a little bit about the qualifying conditions. Now, Katie certainly will, in the background in our comments section, go ahead and populate in the comments section the qualifying conditions for New Jersey. But I was on the New Jersey website, and according to the New Jersey Department of Health, there are 5 top medical conditions among the patients who have qualified into the program. They are chronic pain due to musculoskeletal disorders. Almost 30% of patients have presented with that condition. Anxiety at 24%. And if you remember our last New Jersey Green Chat when we spoke with Sonia Singh, we spoke about how anxiety is actually the number 2 qualifying condition of all CannaCare Docs patients. So that's an interesting correlation there. Number 3, New Jersey qualifying condition that patients have presented with, irretractable skeletal spasticity at 15%, followed by PTSD. Again, PTSD was the CannaCare Docs number 3 presented qualifying condition. And lastly, severe or chronic pain due to cancer or HIV. So those are the top 5 conditions that have been presented by the New Jersey patients, and without a doubt, they align with what we see overall among all of our states as qualifying conditions. So if you are sitting home and you're pondering, wondering if you could perhaps qualify as a patient and you think that you fit into some of these boxes, give us a call. Give our call center a call, 866-846-2420. They can answer your general questions about the New Jersey program. They can answer your questions as to whether or not certain conditions are listed as qualifying conditions. And they'll give you instructions on to how to go ahead and either book your appointment online, or they can actually help facilitate that booking for you right over the phone. So we didn't start off our segment with our shout outs, but I just want to pause here for a moment, Erica, and give a couple of shout outs, because we have an amazing team. You and I talk every day, but we know that there's a great amount of support people who help make the experience, the patient experience, as incredible as it is. So I just want to give a couple of shout outs. First of all, as I just mentioned, our call center agents. We have a consolidated call center where agents are trained not only in the New Jersey regulations, but in all of the state's regulations. So they're able to answer questions for New York, New Jersey, Pennsylvania. It's very important to know that they are such a compassionate group, and they work so very hard answering so many calls each day and talking to patients who have questions or are experiencing frustrations with various registration processes or whatnot. So a shout out to our call center, really amazing team. Just the amount of compassion in that center is just absolutely amazing, and led by Annie, our call center manager. She just is a wonderful leader of the team, and we certainly would be remiss without her. I also want to give another shout out to someone who you hear us talking about each week on Green Chat, but she's kind of our in the background hero here. So Katie does a great job each week. She populates information in the comments. She actually works to help post a lot of the social media that you see ahead of these Green Chats. And she's also our corporate recruiter. So if you're looking for employment opportunities, you may actually have a conversation with Katie. So she wears many hats. She's an absolute bundle of joy, such a positive, energetic person, and we're really thrilled and happy to have her on the team. Erica, would you like to go through the more specific process of the registration in New Jersey, or would you like me to take that on?
Yeah, of course. Super easy. The staff does a lot of work in the background for each patient. And certainly if a patient is capable of handling it on their own, then by all means we allow them. But always keep in mind that we are able to do everything for you. So basically, after you schedule your appointment, you are then going to be contacted by one of our support specialists who will reach out. They'll make sure that you have your ID, make sure that you have your medical records uploaded or emailed over, so that you can see the physician. After you see the physician, which is all done via telemed right now, then you would just be issued your certification. New patients will be emailed their certification. Renewals, the state actually emails it over, so you already know the process and you're good to go. Just always keep in mind, in New Jersey, your card from the state is issued for 2 years and your certification can only be maxed out at 12 months. So be sure that you're always paying attention to the certification expiration as well as your card expiration. So last thing you want to do is have a good certification, but your card is expired, so you can't get into the dispensary. Either way, after the certification is issued, if you are a new patient, then you have to go on to the New Jersey Department of Health website. You then use information off of your certification, otherwise known as an APS, an attending physician statement. You use that information to log in, and then you enter, just confirm your name, date of birth, address, phone number, your contact information. Then you have to upload your New Jersey license. We can take out-of-state licenses as well. There's a slightly different process, and we can walk you through that. But if you are a New Jersey resident and you have 2 proofs of residency by means of a utility bill or tax, IRS communication, court communication, something like that, you can use that as proof of residency with an out-of-state license. If you haven't had a chance because of COVID to update your license to prove that you are a New Jersey resident, we can help you with that. So nonetheless, you upload your proof of residency, you upload your ID. If you were a senior, you would get a discount amount through the state for the card. If you are a veteran or if you receive disability, you can also receive a discount. You would need to upload additional proof of those statuses in order to receive that discount from the state. But otherwise, in about 2 to 3 weeks after you enter all of your information into the Department of Health website, then you would be contacted by the Department of Health. They would let you know that your documents have been accepted and you can now log in and make payment. When you make payment, it's $100, and then it's good for a 2-year card. If you are a senior, disability, or veteran, then you would then have the reduced price of $20. So $100 for all patients and $20 for those that are eligible for that discount. The card is then mailed to you in about 2 business weeks at most. Let's give them as much time as possible because they are dealing with an increase in patient, and they still have the same amount of staff that are still working under COVID precautions. So, we're giving every state a little bit of extra cushion. But nonetheless, in about 2 weeks, you'll have your physical card. And then once you have your physical card, you can go to one of the dispensaries. Therein lies some hurdles. You're going to definitely, in the time that it takes to get your card, ask our staff about the status of each dispensary, but also check out their website, check out their Facebook, make sure that you're comfortable in what their procedure is. Some of them are doing curbside, some of them are allowing patients indoor. Every dispensary is very different. So upon registering, you do need to choose a dispensary. So after you register, just take the time to familiarize yourself with whatever that dispensary's process is, whether it be online ordering, curbside, whatever it might be. But nonetheless, that is the completion of the process. As simply as I can explain it, but nonetheless, the team is there for your assistance. They will reach out to you prior to your appointment, and then we are getting into reaching out to patients afterwards. We have an email address that we follow up on a daily basis, but always give us about 24 hours to respond, and that's the nj@canacaredocs.com. And then, of course, you can always call the call center or call the offices directly, and that communication, that direct line will be provided to you after you schedule your appointment, because it's the staff will be reaching out to you from that line, as well as providing you with direct contact information to the staff in New Jersey. So, we help every patient through the process. It can be complicated for some, and we're there for them.
Erica, thanks for that summary. And for those of you who are trying to frantically take notes or whatnot, again, we have resources which can help guide you through this process. The easiest way is to contact us directly, either through our call center at 866-846-2420, where one of our really compassionate and knowledgeable call center agents can answer your questions. Again, they can either answer your questions, facilitate the booking of an appointment, or you can go directly to our website at www.canacaredocs.com. If you're ready to book an appointment, simply click on Book an Appointment. Select the day and time that works best for you. We will reach out to you to help coordinate much of the preemptive work that needs to happen prior to the day of your actual appointment with your clinician. And again, it's really as easy as that. We strongly encourage you to utilize telemedicine. I know, Erica, I believe you said that you were considering some in-person appointments in July at some point.
Yeah, so just keep a look on our Facebook. We do want to start getting back out into the community to assist those that are having, trouble. Either they don't have a printer or a computer or whatever it might be. We do realize that there is a portion of our demographic that struggles with that, and we want to be there for them as well. So just keep a look on our Facebook. I'll post any of the events or post where me or the team will be. I know that our first event will likely be in the Phillipsburg area. There's a 420 CBD lounge right over the line in Stroudsburg that I intend to assist New Jersey and Pennsylvania patients with. It will be a certification event, so if you are in that area, again, we will be up there in person if you need assistance, and then we'll be partnering with the Apothecarium, which is a new dispensary going into the area as well. So yeah, we'll be out in person to assist those, but primarily everything is telemed. But again, you can always reach out to us, and we do our best to accommodate everyone.
Right. Some sense of normalcy is on the horizon, whether it's a new normal or some semblance of that. We all certainly look forward to getting back out into our communities and really just talking to patients who are interested in the program, who have been in the program. This is how we learn more about you as patients, about the needs that you have, how we can better enhance our workflows to improve the experience for you. And Erica certainly is very much in touch with regulating bodies within the state as well. So she's on the forefront of kind of knowing what's coming down the pipeline, what's on the horizon. And in turn, as she mentioned, our Facebook pages, our website are great sources of information. Katie on the background is constantly updating information on our social media pages, whether it be Facebook or Twitter or Instagram, to help communicate information to you, particularly during COVID. Again, as Erica said, things could change day to day. So if you are a patient after you've gone through the process, check with your dispensaries first to understand what their protocols are. Are they offering curbside pickup? Are they allowing patients to come in? What are the requirements? So really, it's just about communication at this point and really understanding the little nuances of how we have to do things just a little bit differently in this day and age. So again, our website, www.canacaredocs.com. Our direct line to our contact center, 866-846-2420. And again, just keep an eye out for the Canacare Docs New Jersey pages. We'll communicate information as it becomes available to us. So at this point, Erica, do you have anything else that you wanted to share that you didn't have an opportunity to share?
No, just I just wanted to mention that we do have our Canacare Docs patient group, which is a very useful tool for patients to communicate with all of our state patients and our staff. So I know that I personally monitor anything that like patients are, asking questions. It's a really great resource. Again, available through Facebook that you can just ask general questions or just communicate with patients in other states and really just kind of become a Canacare Docs patient community. But I know Katie has been working really hard on keeping that state by state, just posting things that are relevant and creating that community. So I would encourage all patients to just join that as well. We share all of our live events there, and it's just a really great place to be a community.
Absolutely. And the ability to really interact with other patients, ask questions, interact with clinicians even. Our clinicians are also part of the group. Interact with us as members of Canacare Docs, as members of the cannabis industry. So there are many different ways to have your questions answered. So Erica, I want to start off by thanking you for joining me today. You're doing absolutely incredible work in the state of New Jersey and the other surrounding states as well, as is your team. We are very excited about the expansion of our clinical staff to be able to further offer access to our certifying providers from the northernmost part of New Jersey to the southernmost part. We recognize that there's a patient base that really needs the compassion level that we're able to provide. Thank you to Katie. Again, Katie in the background, appreciate all that you do to help make these broadcasts really seamless. Thank you to our call center agents. Thank you for being there for our patients with whatever questions they might have. Thank you to CB2 Insights, parent company of Canacare Docs. Without CB2 Insights and the collaborative efforts there as an organization, none of this would be possible. So thank you to CB2 Insights. Jean St. Pierre, who actually coordinated the start of this program here. So really happy. This is his idea, and his introduction to Eric B Media for me really allowed this to be possible. So thank you to them. Lastly, to you as our patients, to you as our community, to you as our potential patients, we hope that you will consider our services as you're looking to become a medical cannabis patient in the state of New Jersey or surrounding states. We do operate in many states. We are here to help you through the process. We're here to answer your questions. We understand that you have healthcare goals, and if your choice to use cannabis therapies in order to achieve those healthcare goals is the direction that you feel is appropriate for you, then we want to be a part of that journey with you. So thank you to you. Again, www.canacaredocs.com. We hope to see you soon. Thank you. Stay safe, everyone, and have a great day. Thanks, Erica.
Thank you, everyone.